Awesome, thanks. Okay, I love it. We have a fantastic group. Thank you, everybody, for making time. My name's Kate Schroeder. I am the president and CEO at Interact for Health, and we are so excited to have this call today. Really appreciate everyone making time. Hope folks were not up too late watching the Super Bowl last evening. Want to just start out with a reminder about why we are doing this. So the purpose of this session today is really, as Interact for Health, we want to be transparent and open in terms of our strategy and our funding priorities for 2024. Back in 2021, some of you may know, Interact is committed to doing a grantee perception survey every 3 years about how we are showing up in this community and getting feedback from our grantee partners. And one of the areas where we had one of our lowest scores was in clarity of communication around our strategy and funding priorities. So that really is part of the impetus for this, is that we want to be really clear about where we are in our strategy and what we have funded and what our funding plans are for the year ahead, so that we can be as open and transparent about that as possible. So that is the goal of the call today. You can see the agenda here. I'm going to walk us through a brief overview of our strategy and funding from 2023. And then I'm going to hand it over to my colleagues, Ashley Young and Ross Meyer, to walk us through the plans for 2024. And then we're going to open it up to Q&A at the end. So we expect about 15 to 20 minutes there. If you do have questions throughout, particularly any clarifications, feel free to put those in the chat. If it's related to a particular slide where we want to clarify something, we can try to call it out and respond there in the moment. Otherwise, we're trying to reserve the majority of the time, the Q&A, for the time at the end. This webinar is being recorded, and we will share the slides and the link to the recording with all of you and everyone who registered, so that don't worry about taking screenshots. This will be available. The link to the slides will be on our website as well. And with that, we will dive in here to our overview from 2023. A reminder, most of you have probably been familiar with Interact and worked with us in the past. Our vision is that people in our region are healthy and thriving, regardless of who they are and where they live, and really to ensure that individuals in our region have a just opportunity to live their healthiest lives. So we are focused on really closing gaps in life expectancy and increasing life expectancy for all of us across our region at the highest level. Our values, as some of you may recall, so we updated our strategy last year, our 5-year strategy, and alongside of that, we went through a process of updating our values as well, so that they are very actionable, both in our grant making and how we hold ourselves accountable. And just to touch a bit on how these show up in some of our grant making last year, our focus really is on tackling root causes. So we are not here just to address the inequities that exist in our communities today, but to actually get at the root cause so that we ultimately can stop to continue to create inequities. And our second value here around amplifying community power, this aligns to our belief that those closest to the problems are closest to the solutions. And so we are always looking for ways in our grant making and in our work to really share power with our grantee partners and our community partners. And so we'll talk about, as we go through this, some of the ways that we did that through community grant reviewers, hosting community office hours, and other things. And that we partner with trust and we speak openly is really important. We are trying to be open here, and we want you to be equally open with us about feedback for us and how we are showing up in our community. And we are committed to really learning and adapting as we go so that we can be most effective as partners as well. Our role, this is just a reminder, so many folks, and having worked on the nonprofit side for 12 years myself, when you think of a funder, the primary role of a philanthropy like Interact for Health, people often see us as a flexible catalytic funder. That is a hugely important part of what we do, but it is not the only part. We also want to be showing up in our community as a trusted, nonpartisan voice for change. Our revenues are not impacted by what we say. Our revenues come from our investment portfolio. And so if there are ways that we can be showing up and speaking hard truths to our community, please share those with us. That is part of who we are and what we do. We also see our role as being an independent regional convener, helping to amplify that community voice and continuing to be a resource for data around health and health justice. And just to remind folks, these are the 3 priorities that came out of our strategic planning process last year. This is our 5-year, 3-year priorities. The first area around community power building. This is really focused in some of those communities, both rural and urban, suburban, that have experienced some of the greatest health inequities, and how do we work more deeply in these communities. The second area is around policy and system change. This goes to going to the root cause, not just programs that address with inequities, but how can we focus on policy and system change to get to more of those root causes. And the third area around mental health and well-being being our primary sort of clinical priority across our work is really to focus on improving mental health and well-being with a focus on youth. So getting into some of the good stuff, just to be transparent, around what is the grant making that we did last year. So we had a total of 4 RFPs. You can see the names of those RFPs on the right there and the amount that was awarded in each of our requests for proposals. Across those RFPs, we funded a total of 54 grantees. The average amount was just shy of 100,000. And it was a little between 16 months was the average duration. One of our commitments is really to increase general operating support, to be a flexible, responsive partner and give funding in ways that is more flexible for our grantee partners. So 44% of our funding last year was around general operating support. 57% of our grantees were newer partners. 37% were BIPOC led. Those of you who've worked with Interact in the past probably know there are different ways in which we fund. Some is invited, so 25 of the 79 grants, total grants last year, were invited. Others are open calls for proposals, like the RFPs that we're listing here. And we also work as part of collaboratives with other donor partners where we are funding alongside other foundations. And then here, just to share that we are learning, and I can tell you, we're not going to always get it right. We're going to make mistakes, and I do want all of you to let us know when that happens, because for us to be most effective, we do really want to be responsive and be flexible as an organization. We are 22 people, and we have that ability to listen and to respond. And so this is just a picture last year of, like, as we were launching this news strategic plan, we realized, like, what are the ways that we need to improve and focus and learn in 24 based on what we learned in our first year of the strategy. And so that's what the remainder of this call is going to be about what are some of those learnings and insights that came out of our first year, and how does that then inform our planning for 24. So one of the first reflections was just, there is a lot of momentum, that our strategy is aligned with where a lot of our community partners are going. We were blown away. I think we got over 70 responses to all of our RFPs last year, which was some of the highest response rates we ever got, which is wonderful. But it also is hard because it means that we have to say yes to some really great ideas. And it also is a way that we end up, I want to say personally, and I know our team feels the same way, that even sometimes when we're unable to fund something, we've created a link on our application that says, can we share this with others? Like, how can we be a partner to get others to fund good ideas as well, even if it's something that we're not able to fund? We, again, had a big focus on how do we get more community engagement in our grant making process. So having community reviewers, we did that for the first time to help score some of our grant applications, and doing community office hours. So just putting office hours up. Some were virtual, some were here in our Interact for Health offices, and some were out in coffee shops around the community. But how can our program leads be available on a consistent basis just to engage and share with partners and brainstorm around ideas as well? And the third one here, one of our big lessons, we are, as many of you may know, we cover a 20-county region around Greater Cincinnati. 14 of our counties, of those 20 counties, are rural. And one of our takeaways when we go back and look at the amount of funding that is going to our rural communities and rural partners is disproportionately lower than our other partners. And so you'll hear about one of the changes we're making, just how do we be more intentional about making sure that we are also showing up for some of our rural partners, as well as our Hispanic and LGBTQ partners and communities as well. And the last thing to mention here, which we'll talk more about in the next section, is just how are we not just doing our investments in an area, but in the youth mental health space where there are so many partners and need an opportunity to work together to accomplish even bigger things. How are we aligning our funding and work to drive regional progress and broader community progress, and not just focus on Interact for Health's direct investments in that? So with that, I want to hand it over to my colleague, Ashley, who is going to take us through some of our planning for 2024.
All right, so good morning, everyone. My name is Ashley Young. I'm Vice President of Policy and Engagement here at Interact for Health, and really excited to be with you all today. We'll go to the next slide. So as we are talking today, there's just some key refinements that we've made to our strategy just based off of our learnings from last year. We talked a little bit about this around, this year we're able to launch an intentional and comprehensive focus within our rural investment. So really excited to share more details around that. Within our community power building space, one of the things that we have been focusing in on is really identifying and focusing in on 2 to 3 communities to really support community identified priorities within those areas. Within our mental health space, we started off in this space really broad and really have narrowed through the process that Kate mentioned to really have an intentional focus on youth prevention. And so we'll go over some of what those changes have been there. And also moving towards more larger multi-year grants with aligned partners. And so in alignment with what we see a lot in principles around trust-based philanthropy, and also what we hear from you all, is that people need time to do the work. And so we are trying to be very intentional with this strategy of how do we make a transition to make sure that we can support folks for a longer period of times with the resources that they need. And then we revamped our event sponsorships process to be more accessible. This is a process that we've had in place for a while, but it was not on our website, and you kind of had to know someone to get the information. So we really wanted to be intentional about making sure that we have that available. And so these are just some high-level refinements that we made to our strategy. And so we're going to take time now to kind of go through and talk more in detail about what some of these strategies, what some of these refinements look like in each of the areas. Next slide. So this is an overview of our strategy. So really excited about the work that we've been doing. So you'll see kind of in the core, we have our community power building, our policy and systems, mental health and well-being. And so we'll take time today to go through each of these areas and really provide you all some additional context around some of the changes. What you see around the outer rings that says shape better stories, equip stronger leaders and organizations, and establish community accountability to progress. These are what we are calling are just really foundational. And these are key, these are cross-cutting areas, which we'll share some more information about what we are looking for in these areas. So the first area that will provide just some additional context as far as what our strategy looks like is in our community power building space. And so we know that when people have voice and role in shaping the decisions that affect their community, that the resulting policies, programs, and decisions are more likely to be sustained. And so that's really the work that we're committed to, is really the role of helping to shift those power dynamics so that people that are affected by health inequities are in a position to identify the solutions. And so within community power, we have our community-led solutions in place. We have our mobilizing rural communities, and our goals, our overall goals for the duration of our strategy in this space are to increase the number of community-led policy, system, and physical changes, in addition to increasing voice, agency, and resources in community-led plans. Next slide. So what this looks like for us within the community power building space is in 2024, we'll have an invited RFP really focused in on forming deep, trusted, long relationships with 2 to 3 communities within our urban suburban core to support community identified priorities that advance health justice. And so we've really just been taking some time and really just being intentional about building and cultivating additional relationships within our community and our urban suburban core, in addition to working closely with our advancing health justice grantees. And so the thought here is really just, how do we go deep? We know that there is a lot of need within community, but we know that we also have limited resources. And so what does it look to form some deep, trusted relationships? And so that's one of the things we look to do with this invited RFP for community power. And again, it's not any issue specific, but whatever community needs arise that are related to health, just really being able to support those communities. Next slide. The other area in this strategy space is our rural investment strategy. So we spoke before about just trying to be very intentional about cultivating our relationships within our rural community. And so there are a couple strategies that we'll be deploying within this investment strategy. We have our Rural Changemaker RFP. And so this RFP is focused specifically in our rural counties. And so within this RFP, it'll actually be a rolling RFP, which we're very excited about. Just wanted to make sure that we're giving folks ample time to be able to apply. So the first deadline is March 4th. And again, similar to what I described with community-led solutions, is that this area is really focused in on what's arising from the community and how can we be able to support those efforts around health-related issues that have been identified. So again, not issue specific, but more so things that are rising from the community. In addition, we also have event sponsorships that are focused specifically within our rural communities. And then we also launched our rural community councils. And so this will be a convening of members from the rural community who will help to review grants for us, and then also further help inform our rural investment strategy. And so this is what to expect when we look at our community power building space for this year. The next area is our policy and systems. So we know that policies at every level really shape the conditions where people live, work, and play. And policies can make systems to promote health, or they can create systems to continue to perpetuate those inequalities. And so within this space, we're really focusing in on policies that are focused within 2 areas. So we have our advancing mental health policy change, which is focusing on our mental health policies at the state level. And then we have our advancing policy change to address social drivers. And then we have our strengthening the advocacy ecosystem. And so within the advocacy ecosystem, it's this whole notion that we can't do this work alone. It's going to take a collection of organizations working collaboratively together to make sure that we have a strong ecosystem that's working to advance policy and advocacy efforts. Next slide. Our goals within this is really to increase the pace, number, and quality of advocacy and policy wins, and to expand and strengthen capacity, skills, and collaboration of organizations advancing health equity policy efforts. Next slide. So what to expect within this area. So we have our open RFP that will be released, and we're really focusing in on advancing local policy and advocacy efforts that address the social, economic, and environmental factors that shape health. So again, we'll be releasing this, and folks will have an opportunity to let us know within these areas what are some of the issues that you might be focusing in on. And so when we think about social areas, just thinking about like civic engagement, racism as a public health issue, violence, those type of things might be areas in which communities might be focusing in on. When we think about economic, affordable housing trust, legal support for renters, paid sick leave, those might be some examples of things that folks might be wanting to work on in a community. And then neighborhood and really built environment. This can be smoke-free indoor air, complete streets, public green spaces, and so things of that nature. And so this will be an open RFP available for folks who are interested in doing some local policy work. And then we have an invited RFP, which focuses in on supporting organizations to engage in equitable advocacy and policy change efforts that address the social drivers of health and also promote mental health and well-being. And I spoke about this before. This is a notion of really just a collection of organizations that are working within this advocacy space that are helping to advance policy and advocacy efforts. Next slide. And now I will turn it over to my colleague Ross to dive a little bit deeper into the mental health and well-being area.
Thanks, Ashley. Morning, everybody. Just a reminder, if you have questions, and I know there are questions, please drop them in the chat and we'll make sure that we get to them when we have discussion, which we're on good time, so we'll have plenty of time for discussion at the end. So please drop those questions in the chat as it comes to mind. So I'm Ross Meyer, I'm VP for Strategy and helping to lead our mental health and well-being work. So in this space, as Kate mentioned, throughout our strategic planning process, it became abundantly clear through the data, through the community conversations we had, that mental health was an area that the community was asking us to really lean into. Last year, we really took a learning approach and really wanted to understand who was in the community doing important work to address the mental health and well-being of the priority populations that we care about the most. People of color, low-income communities, rural communities, and LGBTQ+ communities. We took a broad approach. We issued 3 open RFPs last year that Kate summarized. One focused on mental health equity, another focused on amplifying youth voice, and the third focused on expanding school-based prevention. And through that, we helped invest in more than 30 different organizations that are doing really important work, again, to address the mental health and well-being of youth and adults, from prevention all the way through treatment. So with that, we also given a lot of tremendous community collaboration around youth mental health, have been a part of convening that I hope many of you are a part of, a broad regional strategy to address youth mental health in our community. And we're joined together with 12 funders and more than 115 different organizations have been a part of this effort. If you're not a part of this effort and want to, just email me. I'm going to ask one of my colleagues to drop my email in the chat and I'll get you signed up. This has been a tremendous effort of our community coming together to really develop a broad regional strategy for what are we going to do to address youth mental health in our community over the next decade. And that kicked off last summer, and we're now at the point where we have kind of the assessment done, where we've understood, listening deeply to young people and caregivers, where the biggest challenges and opportunities are, and we're shifting now into action planning. So the time is still good to join with us and work together as a whole community to address opportunities to improve youth mental health. So for us, in our learning journey, we've both gotten into relationship with many community partners that are doing important work in this space, and through our partnership with many of you in the youth mental health space, have learned a lot about the opportunities for us to make an even greater impact. And we've listened, frankly, deeply to all the many young people who we've engaged through the regional strategy. We had a series of focus groups with more than 60 young people and their caregivers. And as a result of all of that, we are focusing really in on the opportunity within the youth mental health space around prevention that Ashley mentioned. So for us, what became clear throughout all the conversations with young people is that young people are asking for spaces around them where they are in schools, in homes, in communities that are safe, that are supportive, that are conducive to their mental health and well-being. They're not asking to be fixed. They're asking our community to fix the spaces and the conditions around them to be more conducive to their mental health and well-being. And we know for years, prevention has been woefully underfunded, and we see this as an opportunity for us to help identify promising solutions for addressing way upstream the conditions that shape the mental health and well-being of young people. So you can see here the strategy that we're really leaning into this year in the mental health space is around catalyzing safe and supportive spaces by and for youth at school, home, and community. So this is the area, it's fully, for those of you that have been involved with the regional strategy effort, it's fully aligned with the opportunities that are coming out of our schools and community work groups. We really see this as an opportunity for us to start to seed good work that's hopefully starting to move the needle in creating more safe spaces and supportive spaces for young people, with youth leading the way in the environments where they are. So we, again, hope to get into relationship with more partners, continue on with our existing partners to really advance this space so that we can all create, again, more supportive conditions around our young people in the community. Our goal in this space is to really focus on expanding evidence-informed prevention policies, practices, and/or programs in priority schools and communities that reach our priority populations that I mentioned, that promote mattering, belonging, and other factors that support the positive mental health and resilience in youth. So there's a lot packed into that goal, and I want to unpack it a little bit. What we're interested in is really, again, shaping the conditions around young people. So when we talk about policies and practices and programs, we know programs play a critical role, and we're investing in some, and there are many others that promote these factors that are way upstream, but that we believe are critical to getting far ahead of the youth mental health crisis as it stands now. These factors around efforts that help young people feel like they matter. We heard time and again in the focus groups that young people just want to be listened to. They just want to feel like they matter and that their contribution and their voice makes a difference. And of course, we all yearn for a sense of belonging, and connection. All these factors we believe are most critical for us to foster in the environments around our young people. And again, programs play a role in that. Policies and practices in schools, in community institutions, and other systems where young people are have a big impact on that as well. So we're interested in efforts that can address those very factors in young people and help shape the systems around young people to promote those factors as well. And in everything we want to do, we want young people to be leading the way, right? What also was clear throughout all the focus groups that we had with young people is that they're asking and yearning for leadership, not only to be listened to, but they're eager to lead the way. And frankly, after every single focus group that I was a part of, I just felt so inspired and hopeful for the future in a space that's very difficult and so many challenges. Our young people see opportunity to make a difference and are ready and asking for leadership. And so in everything that we do, we want young people to not only be informing, but where possible, have the power to act on their own ideas, because we believe that those closest to the issue are closest to the solution. So in this space, two things for this year. We're going to be, as well as hopefully other funders that have joined with us in the regional strategy, investing heavily in its implementation. So as we are working to build out the regional strategy this year, we're on track to have the strategy in place by the summer. We and other funders, private funders and public funders, we're going to be asking to put up resources to implement it. So it's not just a plan that sits on the shelf. So we're going to be investing heavily over multiple years in the implementation of that strategy. For our own grant making also, you can see here that we're interested in finding ways to really advance this goal of catalyzing safe and supportive spaces by and for youth at school, home, and community. We have many of our current partners that we've invested in through our RFPs last year that are absolutely operating in this space. And as Ashley and Kate have mentioned, we are very focused on moving towards a more trust-based model that invests in partners for the long term over multiple years, so that we're hopeful that many of our current partners will join with us in this journey to go deep on understanding how can we shape these spaces around young people to be more conducive to their mental health and well-being. So part of our funding, we believe this year, will be investing more deeply in current partners that are most aligned with this priority area, and also giving space to identify new partners that are, again, working to change the systems and the conditions around young people. So this language around invited RFP, you might be wondering, what does that mean? That means that because our funding is more limited this year, because again, we're going to be setting aside dollars for the regional strategy implementation. We hope to continue investment in some of our current partners. We have, frankly, less resources to invest in new partners. So we want you to work with us to identify if you're aligned with this goal. We want to hear from you, and we'll share with you at the end opportunities either through our office hours in the community or through just reaching out to our team. We want to learn more about what you're doing in this space, and we can potentially identify opportunities to support that work. All right, I'm going to pivot now to talk a little bit more about what we call the cross-cutting strategy. So if you remember that diagram that Ashley shared, this is the ring around all of our 3 core areas around community power, policy and systems, and mental health. These cross-cutting strategies, we believe, are critical for all of our strategies to really come to life. And if you recall, the language around that circle was around shaping better stories, strengthening leaders and organizations, and establishing community accountability to track progress. So this is all about how do we help shape the narratives and the stories that are around our work. So if you think about the dominant mindsets and narratives around health, for example, many are focused on individual responsibilities when people think about what it takes to improve health. Eating better, exercising, so on, individual choices, rather than the systems and the conditions that shape those choices. So where we have opportunities through our data, through our research, through partnering with the media to shape a more broad story about health and what leads to health equity and health justice in our community, we want to be a part of trying to change that conversation to really illuminate the underlying factors that lead to health and the solutions that can lead to a healthier community. In terms of strengthening leaders and organizations, you all know that for years, Interact has been a significant leader in providing capacity building opportunities for our partners and for the broader community. We want to continue to do that in different ways. So this looks like investing in identifying and addressing specific capacity building needs of our grantees. So we're listening to our current partners to understand where they have capacity building needs and trying to address those as well. We're working in partnership with others, such as through our Data for Equity cohort in partnership with BI3 and HealthPath to expand capacity around data and equitable evaluation. And we're going to continue to listen to our grantees and identify where we can help fill gaps and address some of their capacity building needs as well as we move forward. In addition, we believe that there are key capabilities that our community needs overall to advance this vision of health justice, capabilities around narrative change, around community organizing and building community power, around advocacy. So we're looking to also provide a series of opportunities for not just our grantees, but the broader community to also take part in capacity building around these key issue areas that we believe are critical for our community as a whole to advance towards this vision. And last, around data, Interact for years has been a go-to resource for data on health and health equity. As we think about this broad vision of health justice and health equity, the key question is, how do we define it? How do we measure it? And how do we know if we're making any progress towards it? So in this space, we're looking to not only find ways to continue to make data more accessible and more useful for the community, we're also working with partners to really understand how do we, as a community, define health justice and health equity and make sure that we are on the same page around how we measure it and that we're clear and transparent about how we're doing as a community over time. A couple goals this year in this space. As I mentioned, we're looking to continue to expand our capacity building work in response to both grantee needs and to advance broader capacity building opportunities in the community. And you'll continue to hear more from us about those opportunities. Importantly, as Kate mentioned at the beginning of this, we are committed to listening to our grantees and acting on their feedback. And we are due for our next grantee perception survey. We're going to be conducting that of our current grantees later this summer. And I can't tell you enough about how critical this feedback has been for us to shape our current strategy and our current approach to grant making. And we really value the feedback that our grantees have given us to make sure that we're improving on things that matter to them in the relationship. So look out for that coming out later this year. And last, in terms of the area around community accountability for progress, we're working with partners to put forth a state of health equity report that, again, captures a definition of health equity and a measurement framework so that, again, we know if we are making progress towards a more just and healthy and equitable community. And look for that from us this year as well.
Hey, Ross, can you give some examples of capacity building needs that we have identified, or what we mean by capacity building needs?
Yeah, thanks, Michelle. So a couple came out of, again, we're trying to listen to our grantees and identify where they see opportunities. So with our current grantees, we've engaged them in conversations and surveys to collect that kind of feedback. One that came up early last year was around evaluation, kind of basic evaluation 101. So we worked with partners to put forth a training session on kind of the basics of evaluation that we opened up not just for our grantees, but to the broader community overall. We've heard other opportunities from grantees around, of course, everyone needs fundraising support. And I should have mentioned this as well. In addition to providing and curating our own capacity building trainings, we're also trying to identify what's already out there. For example, AFP has a great fundraising 101 series. So we're supporting our grantees and sponsoring their participation in what already exists as well. So fundraising, for us, comes to the top of the list. Things around communication, social media have also come up. So those, are some of the areas that have come up out of our grantee feedback around areas for capacity building that we're trying to respond to.
Ross, this is Kate. Just to chime in on that too, I want to acknowledge that we are also working with OneSource and Leadership Council around just having one common calendar around what are the nonprofit capacity building opportunities across our community and playing a role to help support the overall sort of suite of nonprofit capacity building trainings that are available as part of that team effort with OneSource and Leadership Council.
Yep. Thanks, Kate. A couple quick things, and then we'll continue on with the discussion. So a couple of key dates that we shared in here, and again, we're going to share out this deck after the webinar. The Rural Changemaker RFP is open, and it has a rolling deadline, as you can see. First one coming up in March. And again, this is for community identified opportunities within our rural counties across our region in rural Ohio, Northern Kentucky, and Southeast Indiana. So you can find out more on our website about that. for the local policy work that Ashley mentioned that address the social drivers of health, we anticipate a release of an RFP that'll be open to the community later this spring. So watch out for that as well. And as Ashley mentioned, event sponsorships. We're trying to make the process more transparent. Information is on our website, as well as a very brief form that you can fill out to submit your request. And we review those also on a rolling basis. You can see the deadlines coming up. Next one's coming up end of March. So for any events that you're putting on in the community that you're interested in us partnering on, you can submit the request through there. We started with this practice last year and got some great feedback. We also really enjoyed it as a team, these community office hours where we just have an opportunity to informally connect with any of you, anybody in the community who want to talk through ideas, get feedback, talk through opportunities. We found them very powerful. So we're going to have a series of office hours. These are the next ones coming up in end of February at our office, and in early March, which will be a virtual option. Also for our rural strategy, we have upcoming office hours as well in our rural communities. And we'll again share more. We anticipate scheduling more office hours throughout the year. So stay tuned through Health Watch about those coming up. Again, it's just an opportunity for us to connect and to talk more about any ideas, get feedback in a more informal setting. All right, with that, I think we are through the content. I am going to drop the slides so we can open it up for Q&A. So you're welcome to drop a question in the chat, or if you'd like to come off mute, you can raise your hand and we'll call on you. What's on your mind? All right, see a question from Brenda. The criteria, what will the criteria be for the 2 to 3 rural communities? Ashley, do you want to take that one?
Yes, I can take that one. So the 2 to 3 communities aren't focused in our rural. So for the rural strategy, that's specifically just the Changemaker grant, the sponsorships in the rural community councils. So in our urban suburban areas, we are looking at the 2 to 3 communities. And honestly, we're still finalizing some of the criteria, but some of the things that we looked at initially were just really focusing in on where our priority populations are located. And then also looking to see and look at communities that have existing work that they might be doing. And so all of the criteria is not solidified yet, but I'm happy to share with you all as we continue through the process around some of what that looks like.
Thanks, Ashley. Had another question about the best way to connect over youth mental health. There are many opportunities to do that. You're welcome to join one of the upcoming office hours. You can also just reach out to our team. So when we send out the deck after this, it'll have contact information for myself and for all of us involved in the mental health work. And we have kind of divided up the work where my colleague Lisa Myers is focusing on school-based youth mental health. So any opportunities within schools can reach out to Lisa, and then any community-based opportunities can reach out to my colleague Deanna. So that'll all be in the deck that we share out afterwards. So you're welcome to come to one of our office hours or just reach out to chat. Hi, Charlotte, I see your hand is up. You want to jump in?
Yes. Hi, everyone. Charla Hale, Healthy Moms and Babes. I wanted to ask about the State of Health Equity Report. Is there opportunities for community partners and nonprofits to speak into some of that data that's presented in the report? Because for us, I mean, maternal and infant mortality rates are going to be something I think is very much a determining factor. And so, yeah, any opportunity to be able to speak into that report would be awesome for us.
It's a wonderful question, Charlotte. I'm going to ask my colleague Kelly Adcock to chime in.
Absolutely. Hi, Charla. Kelly Adcock. I lead our data and learning work, and I'd love to chat with you just specifically about that. But I think that part of this report is, I know we talk about data, but I think we think about data very broadly. Data, we're trying to lift up the data, the information, the stories that help paint a picture of this narrative that we've talked about today around what health justice is, who gets to decide, right? When we've achieved it, how we define it. So I think part of this quote unquote report is trying to lift up that conversation too, and to start that conversation around the data that we have in our community, what it's telling us, and how we invite more voices in to help shape it together. So again, I'd love to follow up with you on that, but that's sort of the overarching ethos and how we're thinking about it and approaching it as a starting point for thinking about some of those critical questions.
Awesome. Thank you.
All right. Alyssa, great question. Asking us if there'll be opportunities for us to learn more about what we've learned from our 2023 investments, what's been going on, see if there might be opportunities for collaborations within our group to increase our impact and chances for innovation. Great question. So through all of our RFPs last year, we have learning cohorts. So those grantees are getting together on a regular basis to share what they're doing, learn from each other, identify new collaborations and opportunities to work together. So that's happening within that group. On a broader level, though, your question is a great one for us to really think about how do we start to elevate as we're we're still early in this work, right? We're just going into a year of the first set of grantees and work together. So as we start to identify what's going well, where there are opportunities for partnership, where there are opportunities for collaboration, how do we start to elevate those throughout this year to our broader community? That's a great question that we're going to think on, Alyssa, because there's so much good work happening, and how do we make that more clear to the broader community and not just within our cohorts? Great, we're going to think on that one.
We have two questions that came in through the Q&A function. The first one is, what are the age groups of the young people in the mental health groups?
Age groups so our youth mental health work we're defining very broadly from 0 to 24. So we're investing in efforts from early childhood on up through young adults. Similarly with the regional strategy, we have not narrowed it any further than that. As we start to develop strategies and specific goals, I imagine we'll get some more focus as we work together over the next couple of months. But we've been engaging, of course, through the focus groups, older young people, mostly adolescents and young adults. We also are putting together a youth fellowship where we're going to have a team of paid youth fellows that are working with us to co-create the strategy. Super excited about this opportunity. Youth at the Center is managing this with us. Those are going to be for young people, adolescent, basically 14 through young adult, 24. So again, we're thinking about youth mental health broadly, and we know that so much in the early years has consequences for the later years, and we want to get farther upstream. So we're, again, thinking comprehensively. But I imagine as we start to get more clear about some of the opportunities and strategies, we'll get a little bit more specific on specific age groups.
Great. The next question in the Q&A is, with limited funding, how do you determine the length of multi-year grants? Great question.
That is a great question.
I can jump in.
Go ahead,
I think
Ashley.
it's really a conversation with our grantee partners. I don't think one size fits all. So really just depends on the work that people are doing. And I think you bring up a great point, like, we do have limited funds. So I think it's really a partnership of really figuring out what does that look like given the type of work that grantee might be engaged in.
Great. We have two more questions that came in. Does Interact bundle substance use disorder and mental health?
Great question. So we do think about our mental health work broadly. Behavioral health, and for folks in the field, is the umbrella term that captures both mental health and substance use. we're using mental health and well-being as a more kind of lay term that's more accessible to the broader community. But we include substance use kind of within our conception of mental health. Again, within our mental health focus this year, we're looking at more upstream prevention. And we know that prevention of mental illness and substance use for young people are around some of the very same factors, right? The protective factors that help young people relate to both prevention of substance use and prevention of mental health issues. So again, we're thinking of it broadly and inclusive of both mental health and substance use. The language we use is meant to be a little bit more accessible, though, if that makes sense.
Awesome. And we have one more question in the Q&A, and this individual joined late, so they were asking if we could say a little bit more about the regional strategy, just talk a little bit more about it broadly since they missed that part.
I could talk about it all day. It's super exciting. So I'll give you the snapshot, and please reach out to me. Someone could drop my email again in the chat and reach out to me, and we can talk more. So this is an effort that we, along with 12 funders, came together about a year ago to really help. We heard the opportunity from our community to really pull everyone together, working in the youth mental health space, to develop a strategy together that we could really address the issues at a systemic and long-term level. So we've been working with many partners all the way from August to end of last year, 115 different organizations coming together on a regular basis. And we've meant to kind of have a big tent of organizations interested in youth mental health, from big providers to small grassroots organizations and everything in between, working together, listening deeply to young people through our focus groups to really understand the challenges and opportunities. That concluded in kind of a community assessment that is now shaping our action planning. So we're right now moving into working groups around schools, around community, around treatment, to start building our action plan that we aim to have ready by the summer of this year. That's really going to be our community strategy for improving youth mental health over the next 10 years. That has a lot of input from young people, from all the stakeholders and partners that are involved in this space. So again, it's not too late. You can join in, reach out to me. We can get you plugged into one of the working groups. It's a tremendously hopeful and aspirational effort on behalf of so many in our community, with significant leadership and voice from young people themselves in shaping what this should be. So reach out. Happy to talk more. Any other questions? I got a question. It was a direct question to me, but I think it might be applicable to some others as well. Asking about any consideration given to a new nonprofit supporting the mental health of healthcare workers. We'd love to talk more. I mean, our healthcare workers and so many other folks on the front lines are struggling, and just like all of us have mental health needs. So we'd be happy to talk more. Again, our focus specifically this year is really diving deep on youth and youth prevention. So we'd want to really think about how it relates to that focus, but we're always happy to talk and brainstorm together and make any connections. And then another question, does Interact give grant bump ups to smaller nonprofits with modest budgets? Great question. So one thing that Kate highlighted in our grant making from last year is that, I forget the exact percentage, but nearly half of all grantees last year were new grantees to Interact. Many of these were smaller organizations, some bigger organizations, but half of all the grantees were new to us. The other half were partners that we've worked with in the past. So again, we're trying to identify how can we continue to work with our longstanding partners that are aligned with this work, and how do we find new organizations as well. One thing we also did last year that specifically relates to this question was update our policy around overhead. We know overhead and funding practices around overhead are toxic for nonprofits in many ways, and it doesn't let organizations actually survive and have the resources to operate. So we updated our overhead policy so that we have a tiered system, so that smaller organizations, I forget the exact tiers, but smaller organizations basically get a higher overhead allowance, up to 15%. That's tiered down to 5% for the biggest organizations. So again, because we understand the burden on smaller organizations, and we want to reduce that burden because we see a lot of value in the work that they do in the community, we tiered our indirect policy to invest more in those smaller organizations. So that's one way in which that we're trying to update our grant making practices to be more equitable.
We did have one more question come in the Q&A. Someone said they would love to talk about how Interact might convene health equity advocacy work across multiple agencies.
Yes, I just sent you a message with my email, Rena, so I would love to connect with you. And that's something that we've actually talked about before. So please reach out.
And I think that is a great point to wrap up on, because I do think so much appreciate this discussion today. And as you can see, where we are pushing ourselves is not just what are we doing with our direct resources and time, but how can we facilitate broader efficiency and progress across our community and region, whether that's in the mental health space and data for equity, sharing out, Alyssa, from the learning networks. There are so many ways to do that. So really appreciate this conversation. And I also want to acknowledge Jim Schwab, who is a previous CEO of this organization, and it is on his legacy and the work of many others that come before us that we continue to learn and build upon. And just thank you for all of our partners here. This is not a one-off. We are continue as we know more, we will share more. If you're not signed up for Health Watch, please sign up for Health Watch. That is anytime we have a new funding opportunity or share funding opportunities from others, it goes out through Health Watch, our newsletter, and all of our emails are on the website as well. And please do not hesitate to reach out with any and all feedback. I always say I'm committed to running to criticism. That's how we learn. We do better when we know better. So please continue this conversation, and just thank you all for being part of this today. We really appreciate it. Thanks.
Have a great day.
Thank you.
Thank you all.